were all established as of September 1, even though the paperwork didn't come until probably the end of October. But anyway, so we started September 1, and between September and December, we undertook a lot of different consultations to hone in on what our goals, what structure would enable those goals, what our membership would be and what membership entails, and what the research priorities would be for each for this research program, because we have a 3 to 5 year duration. And what I mean by that is we have a 5-year memorandum of understanding, pending a successful review in year 3. So we need to show that we're productive, we're meeting our goals and objectives, and specifically in terms of health human resources, we want to address some of the key challenges in this domain. So these challenges will not be new to you as researchers in this area, or decision makers in this area, I should say. So there are critical issues, and there has been a lot more interest attending to issues around health human resources, although there's always been this kind of long-standing concern with these issues. So there's a lot of research. Much of that is uncoordinated. So we, just as an aside, because I sort of wear 2 hats in regards to health human resources. I'm the lead of this research network, but I also hold a CIHR and Health Canada Research Chair in Health Human Resources. And so while we were developing this research network at the Ontario level, I have made it really clear to people in Health Canada that this is a really promising practice that we need to expand on a pan-Canadian level. And so we are lobbying hard to see whether or not they will help establish something through Health Canada at the national level. So beyond that and using this to kind of leverage those funds, if we have much more collaboration within Ontario, we're much better positioned to make those linkages nationally to this unit that we might develop in Canada and internationally. And also a collaborative provincial network would better enable us to respond to ministry concerns and needs for evidence for policy development. Other challenges is there's a general lack of capacity in health human resources research, both within the academic research community and the policy decision maker community. And so, I mean, there's a lot of us who focus on this research, but it's still a fairly small area. And so we really do want to build capacity on both sides. And there are a variety of neglected content areas which a coordinated network would be better able to address. So there's a lot of us doing lots of research on, for example, interprofessional initiatives in primary care, but we need to start branching out to other areas. So the goals of OHHRRN are to undertake more and better health human resources research, more coordinated anyway, in Ontario with an Ontario focus, and to use the funds that we've been provided in OHHRRN to leverage funds vis-a-vis other sources, whether that be Health Canada, CIHR, NIH, and elsewhere. Second, to enhance capacity in health human resource research in the province. And we think about in terms of that research production capacity, so actually producing research in these areas where there hasn't been enough, and to have more graduate students, young researchers who are focusing on this area, as well as community and decision maker receptor capacity, so that we also develop capacity to use the research that we're developing. And thirdly, to inform policy and practice regarding health human resource issues. The overall budget is modest, but a really good start. It's about $250,000 per year for 5 years, again, pending a successful year in 3. We cannot roll funds from one fiscal year to another, so that particular fact might help answer some of the frequently asked questions that we have with our call for proposals, but sort of keep that in mind, and we'll come back to that. We are sharing significant resources with the OHHRRN infrastructure that's created. We share an office space, and we share a director. I'm the director of OHHRRN for this, as well as drawing on some of the resources that I bring with the research chair. Now, so our proposed approach is to develop a pan-Ontario network of health human resource researchers, planners, and community partners. And this is to build on the current research and community relationships that already exist. So Craner has been doing a lot of health human resource researchers, the Nursing Health Services Research Unit, CHEPA, and the Queen's Center for Health Policy. And we will also want to develop linkages with other OHHRRN partners. So, for example, the primary care research program that Moira Stewart is leading is doing a lot of work that's health human resource related, and so we want to coordinate what we're doing with them again, so that we're not duplicating efforts. We'll be contacting interested researchers, so I'm hoping that you will all be involved in this. To add your name to a database that we're creating that captures your area of health human resource interest and expertise. And we are creating sort of like an online survey where you would put your relevant contact information, and then you would check off boxes that reflect your area of expertise. We would allow you to either have that available on the public domain on our OHHRRN website, or we can keep it in the intranet portion of the website, which would mean only other network members would have access to that information. And we are just going to leave that up to the researcher. So it essentially means we'll have two databases, one that's public and one that's probably a bit larger that will encompass the people who would like to keep that information. It's sort of semi-private. And it's not really a huge deal to become a network member in terms of getting access to the intranet anyway. We'll talk about what membership entails. We want to be responsive to the research needs and develop a collaborative working relationship with any potential provincial HHR advisory or planning body. We understand that there's one proposed or in the works. And we want to be responsive to those needs as well as responsive to the HHR division within the ministry. And so you will see in our next point, we have undertaken consultations and have identified some issues that we would kind of broker through OHHRRN to try to get expertise to respond to those issues. So it's not that everybody here at OHHRRN in our particular office at Ottawa will be doing that, but we will be brokering that. In terms of being responsive, in some cases we need to undertake a synthesis and or do some primary investigations of key HHR issues supporting the Health Force Ontario strategy. Now, so that brings us nicely to the point of what these research networks have been identified to do. So there's this balance of doing ministry responsive research and investigator-driven research. So just as with the other OHHRRN networks, SIREN and FERN, and the Francophone, OHHRRN needs to devote approximately 60% of its activities and resources towards ministry responsive research. But we've also protected 40% of investigator-driven research. And I use protected in a very positive way there. And the argument that I was making is that the ministry may not know what it needs to know at all times, and it's important to enable researchers to be at the cutting edge so that the knowledge that they develop may be of use later on to the ministry. But the 60% is something that's really quite salient and necessary for the ministry in order for them to move forward. And when we use the term ministry responsive, it's, again, purposive that we didn't say ministry directed. So ministry responsive means that there's very much a negotiating process there. And a variety of different researchers. So if you became a member of OHHRRN, you could be doing investigator-driven research, or you could be drawn in to do something that's ministry responsive. It really depends on the topic. We haven't allocated that the call for proposals, all investigator-driven, and everything else that we do at OHHRRN at the hub level is ministry responsive. So it's quite fluid in that way. I just want to mention briefly the kind of knowledge translation or exchange tools being discussed by the ministry. We've basically categorized them in terms of time, rapid response being 24 to 48 hours, really, really quick kind of feedback that they need.